Surgical guides are not just another product. They are our only product. At All On Guide, our intense focus, extensive anatomical understanding, and deep knowledge of implant and surgical planning guarantee superior quality and accuracy, because precision is never optional. All On Guide, guide for all. Here are a few benefits and advantages of surgical guides: enhanced precision and accuracy, reduced risk of complications, minimized surgical time, restoration-driven implantology, predictable results. All On Guide workflow has 5 stages: preparation, planning, guide design, guide production, surgical procedure. In most workflows, errors that lead to delays or failures often originate from mistakes made during tomography capture, the most invasive stage of the preparation process. Therefore, it is essential to pay close attention to detail to prevent potential risks to the patient and to avoid wasting time. CBCT scan protocol for dentulous cases. Accurate occlusal registration is essential. Teeth should not overlap, and there should be a gap of about 2 to 3 centimeters between them. This can be achieved by biting down on the inner part of the syringe. The tongue must be positioned at the back of the palate, with the tip touching the vibration line at the back of the mouth. Patients should keep their heads still and avoid swallowing to minimize motion artifacts. Export the scan data as multi-slice DICOM files. Do not export as a viewer CD or a single DICOM file. Isolate the tongue, lips, and cheeks using cotton rolls or a retractor. Additionally, using a cheek retractor during the scan is recommended. This step is so essential that we wanted to emphasize it twice. The cheeks and lips should be retracted even in dentulous cases. The tongue should be rolled back for scans of either the lower or upper jaw. There should be a 2 to 3 millimeter distance between the upper and lower jaw teeth. Edentulous dual scan workflow. What you'll need: existing denture or a copy, hard-relined metal-free acrylic, non-metallic radiographic markers, quantity 6 to 8 per jaw, radiolucent bite registration material. Denture preparation. Apply a thin, even layer of hard reline material across the entire intaglio surface of the denture. Remove any metal claps, wire mesh, or metallic crowns before relining. Place 6 to 8 markers on the facial and lingual extaglio surfaces in staggered planes. Do not place markers on the intaglio surfaces. Do not remove the markers between scans. The markers must stay in identical positions for CBCT scans. CBCT scan number 1. Denture only. Place the denture on a foam block with the markers still attached, intaglio side down. Use a bone threshold of 0.1 to 0.3 millimeter voxel size. Confirm full capture of intaglio and extaglio surfaces, as well as each marker. CBCT scan number 2. Patient wearing dentures. After placing the denture with the hard reline material in the correct position in the patient's mouth, insert a radiolucent bite registration between the teeth. Instruct the patient to bite firmly. Gingival blanching is expected. Take a regular implant CBCT with the largest FOV. Upper jaw. It would be even better if the scan could be extended up to mid-orbitals in case of a zygomatic or transnasal implant decision. Lower jaw. The entire mandible with slight clearance below the chin. Verify that there is no air gap between the scan prosthesis and soft tissue. All markers are visible. Dentures are fully seated. Perform a 360-degree scan with your intraoral scanner to capture both the inner intaglio and outer extaglio surfaces of the denture. During the 360-degree scan of the denture, the hard reline material must remain in place and should not be removed. Please obtain the upper and lower jaw and the bite scan of the dentures if the case is upper and lower edentulous. If you don't have an intraoral scanner, there's no need to worry. The CBCT scan of the denture should suffice. Log into your All On Guide account and upload all of the following: denture-only CBCT, patient with denture CBCT, 360-degree surface scans of the denture, full-face smile and retracted patient photos. Quick accuracy tips: hard reline before any scan. A stable denture equals a more accurate guide. If the opposing arch is dentate, separate arches by 2 to 3 millimeters during the patient scan. Review slices for artifacts and marker visibility before uploading. Zip all the files before uploading. Name your files clearly before zipping and uploading. General tomography requirements. Recommended field of view value: 120 millimeters by 120 millimeters. Ensure that the scan encompasses the entire jaw. If a 120 by 120 field of view (FOV) is not feasible, An 80 by 80 FOV can be used, although it is not preferred. Partial filming and stitching of tomography scans are not accepted. For optimum section thickness, use 0.3 millimeters. Slices that are too thin result in grainy images, while those that are too thick lead to a loss of precision. When saving DICOM images, it is essential to save them as separate files in DICOM format. Export scans as DICOM data, not a viewer CD. To send us your data in compliance with HIPAA protocols, please register on our secure portal and create a new case. Please provide all relevant details and procedure information in the explanation section when uploading your case. This information is crucial for proper planning. Which brand of implant will be used? Where will they be placed? Are there any teeth to be extracted? Is there any tooth mobility? During the planning phase, we utilize the FDA-approved RealGuide software. The software registers the model, wax up, and tomography data. Based on the information provided in the work order, a pre-plan is created. After pre-planning, the clinician and all-on-guide team finalize their plan together via Microsoft Teams, which is also HIPAA compliant. In planning stage, the case is evaluated in both 2D and 3D. The planning for implants is done with a focus on prioritizing the restoration. Implant locations, dimensions, and depths are carefully planned to consider critical anatomical structures. Teams meeting will be recorded for quality purposes. Once the clinician approves the implant plan, the surgical guide is produced using biocompatible, FDA-approved photopolymer resins, titanium alloy, or chrome cobalt. The production process utilizes 3D printers equipped with advanced technology to ensure maximum precision. All-on-Guide is capable of producing all types of guides, such as bone-supported guide, tooth-supported guide, mucosa-supported guide, stackable guide, bone reduction guide, scallop bone reduction guide, zygomatic implant guide, pterygoid implant guide, transnasal implant guide, osteotomy guide, sinus lift guide, endodontic guide, ridge expansion guide, osteodensification guide, gingivectomy guide, robotic navigation guide, and so on. If you need a surgical guide, All-on-Guide can provide it. Stackable surgical guide. Stackable surgical guides are an advanced variation of traditional surgical guides. These guides allow for staged procedures, facilitating complex surgeries that require multiple guided steps. It is a must-have system for immediate loading cases, as the surgical guide is always fixed to the jaw, and the guide fit isn't affected by the anatomical changes that occur with tooth extractions. The system is adaptable to both photogrammetry chairside solutions and pre-operation milled provisional solutions. Stages of the stackable guide procedure. Position guide. The position guide is stacked on top of the base guide, which will later serve as a bone reduction guide if required. The base guide remains in the mouth throughout the entire process, while other guide components detach and reattach using magnetic components. The bone reduction guide is used to accurately reduce bone to the desired size and shape for the surgical procedure. The goal is to retain as much healthy bone tissue as possible. The surgical guide is intended for use with precision drilling tools to ensure the accurate positioning of implants. The check guide is utilized to verify the bone reduction level. Assess abutment angulation by using markers on the check guide. Ensure the lines on the check guide align with the screw hole on the multi-unit to confirm proper positioning. The restoration guide is positioned on the base guide with magnets for accurate alignment. The titanium cylinders are attached to the restoration using pickup resin. Once cured, the restoration is removed, and the connector legs are trimmed as necessary. Here's a sample operation video. Zygomatic pterygoid surgical guides. In severely atrophic maxillary edentulous cases, traditional dental implant approaches often require complex bone augmentation procedures. Zygomatic and pterygoid implants offer a robust alternative, but precise placement is crucial due to their considerable length. Minor drilling angle inaccuracies can significantly impact implant success. underscoring the importance of guided surgery. However, many surgeons face a major challenge. Conventional implant companies typically do not produce dedicated guided kits for zygomatic implants. The innovative all-on-guide zygomatic implant guide solves this critical issue. Our patent-pending universal stackable guide system uniquely adapts to all available drill kits worldwide. By easily replacing specific guide components tailored for each drill, our technology ensures unmatched precision and accuracy across any implant system. All-on-guide technology provides universal compatibility with all zygomatic and pterygoid drill kits, superior precision for accurate implant placement, protecting critical anatomical structures, simplified surgical workflow through intuitive stackable components, reduced procedure times with predictable results and immediate prosthetic integration. Experience enhanced surgical outcomes and confidence with the All-on-Guide Universal, Stackable Zygomatic Implant Guide. Precision and versatility simplified. Thank you.